presenting me, and a few things. I'm not about to read that. That was quite powerful. The other thing is I had a PowerPoint presentation. So this was supposed to be a PowerPoint presentation, but we are having problems with the PowerPoint. So unfortunately, it's not going to be the best because there are diagrams that I wanted to show that I won't be able to show. The other thing is I remember, I think at least there's one face that I remember seeing years ago when Tracy started this. And it used to be like maybe 5 people with her 5 kids and her. And I used to come to the events then. I remember seeing you at some of the events. So it's so wonderful to see that this has grown so much. What a great job. And I remember giving my story. I think you were there when I gave my story about how I am going to get so I will be focusing on mental health of immigrants, and I know a lot of people in this room. Some people are immigrants and some people are not immigrants. So for some people, but I think you should think about it more broadly in terms of addressing issues of inequity. And as women, whether or not you're an immigrant, you face some form of inequity that is really intersection with your social position and issues related to your gender. So I'm an associate professor at the Faculty of Nursing, University of Alberta, and over the past 6 years I've been involved in about 40 funded research projects related to the area of immigrants' health. That's my area of expertise. And one thing I'm just on the, I've done work on temporary foreign workers, I've done work on immigrants' mental health, I've done on African immigrant children. The biggest thing now on my agenda is I'm creating a network of scholars across the globe focused on addressing the health of African immigrant children, and we have 26 members spread across US, UK, Australia, Canada, New Zealand, Netherlands, and South Africa, Ghana, Nigeria, and some other countries that I can remember. So the presentation that I'm going to be making today was the studies were funded by Stollery Children's Hospital Foundation through the Women and Children's Health Research Institute. And again, I had things, and this is all supposed to be, and I hope that this won't be so boring because it's supposed to be actually PowerPoint, and also policy-wise for children and families. So in 2016, we had 7.5 million individuals in Canada that were foreign-born immigrants, and we have 21% of the Canadian population that are immigrants. So the number of immigrants in Canada is growing. Alberta has the highest increase in the number of immigrants. Of course, Toronto has the highest number of immigrants, but over the last 10 to 20 years, the highest surge in the percentage of immigrants has been in the province in Alberta. And of course, Edmonton is one of the unique places. In terms of immigrants' health, the last piece of evidence suggests that immigrants, contrary to popular belief, arrive in Canada, on average, healthier than Canadian-born population. So a lot of times we tend to focus on refugee population, but remember refugee population, a very small set of the bigger immigrant population. And the health of the broader immigrant population does overshadow the health of the refugee population. However, we know that after 5 to 10 years in Canada, the health of immigrants declines after about 5 to 10 years in Canada. And the reasons for this is, of course, issues related to access to health care, and especially social determinants of health. And I'll talk more about what I mean by the social determinants of health. And studies worldwide have pointed to increased risk of mental health problems among immigrant populations. So first, before I talk about social determinants of health, I'll talk about issues related to immigrant women specifically. So we know that we have more and more immigrant women that are migrating to Canada as economic migrants, and that we know that immigrant women are more likely than Canadian-born women to have completed a university certificate or degree at bachelor's level. So 27% of immigrant women have a university degree, as opposed to 19% of Canadian-born women. And this information that I'm presenting is from Statistics Canada. I can actually just, like there's a page that you can get all this from. Completion of graduate degrees, graduate level studies is more common among immigrant women. So 9% of all immigrant women have a graduate degree as compared to 4.9% of Canadian-born women. We also know that immigrant women are more likely to work below their qualifications. And of course, there are also some women that are Canadian-born that are that also work below their qualification. So we do have people that are Canadian-born that have a degree, and they're working in a job that requires you to have a certificate. So 48.6% of immigrant women are working below their training, and 32.8% of the general Canadian population are working below their training. Immigrant women also have a higher unemployment rate. Unemployment rate for immigrant women was 9.1% compared to 6.9% for Canadian-born women. Immigrant women also take longer to integrate into the labor market than immigrant men. And some of the reasons for this is because as an immigrant woman, you have some other issues, and for example, your gender roles that you have to attend to that impedes integration into the labor market faster. So some women, for example, may take time to take care of the kids, while of course, men find it easier to integrate because, many of the work, of the care work, is being left for the woman to do. Prevalence of low income, of course, is also higher among immigrant women. And what are some of the reasons for this? Of course, some of the reasons are credential recognition and assessment for immigrant women, issues related to language and being able to integrate into the workforce with language, and also social connections. Immigrant women tend to have lower social connections than their Canadian-born counterpart. And also, immigrant women are less likely to participate in organizations and associations than non-immigrant women. So why is this all important in terms of health? And sorry, I'm supposed to, this was designed that I have a PowerPoint. Because income is a very, very powerful determinant of health. And I think, she was saying, if you want to be empowered, and someone said, marry a rich guy. There may be some truth to that. Because there's nothing that's more powerful, even more than biology, than having income. And I'll show you, there's a research that we did that we actually found that your education was not a strong influence on your mental health as much as how much you were earning. So you can, have a PhD, but if you're driving a cab, then what's the point? I have some quotes here, I guess I'll have to read. This is a quote from a study that I did, and I interviewed immigrant service providers, about 58 of them in Calgary and Edmonton, on the mental health of immigrants. And one said in the beginning they are facing their language problems as well as their income problems. I think income problems, and they're finding employment related to job, and especially if somebody is having good kind of education, good degrees over there, but denying their credential here, not accepting it, as long as they have to go through lots of long process. So it's one of the reasons of unrest. The other thing that we've uncovered is issues related to community belonging. And she did talk about it, the previous speaker. That really, if you want to feel empowered, it's really the connections that you have to the community, and to what extent do you feel that you belong to your community. And one of the challenges, as I said in my previous slide, is the associations that immigrant women tend to have lower associations, engagement with associations and organizations, volunteer activity, their political participation rate is lower, and how this in the long run actually contributes to mental health, social isolation. So this person talked about, there was one that I did, and I can read this long quote, that talked about a woman that just migrated from Syria. She was living in a neighborhood where she doesn't speak English, and the area had no one that speaks, Arabic, that she understands. And she woke up one day and she was packing all her bags, and she's like, I'm gonna move back to Syria. And of course, there's nothing she's going to go live there. She doesn't have any house there anymore, everything is destroyed. But she was just in a mental health breakdown because, of course, she doesn't have the connections. And what they had to do for the woman was relocate the woman and take her to a zone where at least she understands the language, so a place that had a lot of Syrian people and where she was able to communicate and socialize. So again, the whole idea about the influence of community belonging. So in a study that I did that was funded by PolicyWise with some international partners, we looked at the Statistics Canada database to find out about the influence of social determinants of health. And social determinants of health are the causes of the causes. So when people say, why do you have diabetes? Some people will just think, yeah, because, you can explain all these physiological things. Or why do you have a heart attack? You can explain the physiological things. But there are underlying causes related to social conditions that may influence your chances of being prone to those kind of conditions. And those are called social determinants of health. The most important social determinant of health is income. Public Health Agency of Canada also has other social determinants of health, such as community belonging, social network, your physical environment, your culture, your race, all contributes to determining your health status. So we looked at the influence of social determinants of health on the mental health of immigrant population. And what we found is, in the database, that mental health of immigrant and Canadian-born, that there was no difference. In the mental health of immigrants and Canadian-born when you look at it. But when you break it down to when the person had been in Canada for, then there's a difference. And the surprise, and this article, I can, if you want copies of it, I can email it to Tracy and she can have it available tomorrow. The study is published in the Canadian Journal of Public Health, is when you break it down. In the first 5 years in Canada, immigrants were actually reporting better mental health scores than Canadian-born population. After they've been in Canada for 5 to 10 years, then they start reporting worse health scores than Canadian population. So when you look broadly, there's no difference, because when you mix, the rate, and why are they reporting better mental health scores? Because the biggest chunk of immigrants are economic migrants. And a lot of times before they come to Canada, they've been screened out. If they have any health problems, they wouldn't be able to come. So we have 300 economic migrants coming to Canada, and we've screened them that you don't have this problem, you don't have HIV. We may have another 30 that are refugees. They could have all health problems, mental health, but because they are small, when you chunk all of them together, refugees and immigrants, the health of the 300,000 people overshadows the health of 30,000 that comes in as refugees. But after the longer they've stayed in Canada, their health, they report the poorer mental health status. We also looked at factors that contribute to mental health, and there's a Statistics Canada lab at the University of Alberta, and you need a password and things to be able to get in, and some security clearance, and we were in the lab a few times and we did a lot of manipulation of the data. And no matter how we manipulated the data, the factors that are most likely to contribute to your mental health are your income and whether or not you feel you belong to a community. When you feel you belong to a community, your mental health increases. And when you are rich, your mental health increases. So, for example, if you feel like you belong to a strong feeling of belonging to a community, your mental health is like, it influences your mental health by about 4 times more than a weak feeling of community belonging. The other thing that also influences is employment status, whether or not you're employed, but not as strong as income and community belonging. And there was a lot of times, sometimes in these models, when you do the statistical analysis, sometimes when you put in different variables into it, it may change things a bit. But no matter what you put into it, community belonging and income were always like, wow, this has a strong influence on mental health. I had a diagram here I cannot show. We also looked at, in a study that I just did, we looked at the mental health of, and sorry, I know this is supposed to be about women, but we looked at also children. We looked at mental health of children. And across outcomes, and the indicators that we looked at for mental health of children were peer relationship problem, whether the child had relationship with peers, whether they had conduct problems, so children behaving badly, emotional problems, and also we were looking at the positive stuff of a child being just pro-social, which is actually a positive indicator of mental health. And of that, we found influences related to gender. And the influence related to gender that we found was gender was statistically significant. For males, male children were more likely to have conduct problems, so behave badly, hyperactivity. Females, though, were more likely to have emotional problems. And this is consistent with the literature, that females are more likely to be depressed, and issues related to psychosis are a little bit more common in males. So, we need to always consider gender. We also, in our analysis of the Canadian Health Measures Survey, the same one that I just spoke about, it shed light on diagnosis of mood disorders. Was more common in females than in males. So, for example, depression. Females are more likely to report depression than males. And again, other factors that influences diagnosis of mood disorder includes community belonging and income status, as well as employment.
Yeah, so I just have a question. I know that I think generally men have higher suicide rates. So you're saying that women are more likely to have mood disorders or depression. Do you think that men are underreporting depression or mental health issues?
I am not sure. I mean, there may be like cultural and gender-based issues, but it's not only the study, but it's consistent that, I mean, like I'm not saying mood, I mean, like things like psychosis, men are more likely to report that.
Yeah.
Things like depression, women are more likely to report that. And that is consistent in some of the literature, what some of the literatures have found. But of course, it is possible that there are some like, gender influences on the way people perceive, and men don't cry, for example, but females are allowed to cry. So that could be it. Gender roles. The other thing that we found is gender roles influences women's ability to develop social networks and ultimately influence their mental health. So, for example, in a lot of immigrant families, or not just immigrant families, non-immigrant families, immigrant families, as a woman, you have a child, you're home all day. Like I just had I have two toddlers, 18-month-old, and I can't imagine if I'm there with them all day, and then you come back and someone asks you, what have you done? And it's like, this! And it's like this, and I'm tired, right? And it's not just that I've done this, I've not been able to talk to people like you've been able to talk to people. And there's the influence on that, and being able to develop social networks. Gender also intersects with immigration status and class status to influence the decision immigrant women make about their life. And I have a quote here. I don't know if I should read or just explain. I'll explain. So I interviewed some people about the temporary foreign worker program. I interviewed some service providers in 2015, 2016. And they told me about temporary foreign workers. Sometimes the females, they're pregnant, right? But they want to keep their job. And they struggle between, should I keep the job or keep the child? Because they know that if the employer finds out that you're pregnant, they will lose their job. The employer will not say, you lost your job because you're pregnant. You know, you just realize that in some way, somehow, you lost your job. They've seen this happen, right? So they come to a temporary foreign worker service provider and basically try and indirectly ask her, is it okay for me to have an abortion? Because I need to keep this job. So I'll read the quote. Although the quote doesn't fully explain it like I explained it, she said, like we have seen that when they have 2-year work permit, so especially those that have 2-year work permit, because the employer has to renew your work permit for you to continue. We have seen that they are being terminated. And of course, the employer will not say, you're terminated because you're pregnant. They will not say that. Of course it is illegal, but still they can always quote it in a different manner. But I have in the past several locations, like I've encountered probably 2 women who tell me that that she would probably feel comfortable if it comes from me to have a child aborted, right? And the reason why she is really in this dilemma of aborting is because she knows that, you know, for example, if she is, you know, 1.5 years into the job, you know, the employer will, and if she loses her job, that means she can stay in Canada and she can continue to provide for her kids. So that is some of the challenges. I mean, sometimes we think all these horror stories that it's, you know, happening in another third world countries. There are things happening in our doorstep here. The other one that someone told me, and I don't have a quote for this, is issues related to domestic violence among temporary foreign workers, women who are married to temporary foreign workers. So you're married to a temporary foreign worker, and the reason why you're in Canada is because your husband is in Canada working as a temporary foreign worker. He's beating you all day, you're experiencing domestic violence. You have 2 options. One option is to shut up and continue being beaten, hopefully you don't die. The other option is to say something, right? And then what happens if you say something? It gets a criminal record. If he gets a criminal record, he can't stay in Canada. If he can't stay in Canada, you can stay in Canada. You end up going back to your country anyways, and hopefully you don't die, right? So this is some of the challenges that some populations in Canada still face. So sometimes we think inequities and injustices, but there are things within our system that prevents the well-being of people within our country. And the new research I'm trying to move into now, I've not gotten there, is traffic victims, and that is even a whole new set of worms that, you know, I've not explored yet.
With the temporary foreign worker who is pregnant, would the discrimination laws here apply to them, or they would be eligible to choose that course?
Well, it depends, right? So for example, you get a 2-work permit. So this one was talking about the 2-work permit, right? And let's say you already have, you know, maybe the employer has already promised you that they will renew your work permit for another 2 years, right? The employer has no obligation to renew your work permit. And then if you tell the employer that you're pregnant and it's only remaining 5 months, he will just allow you to finish the 5 months and not hire you again, right? So then your option is, you know, should you just abort so that then the employer can continue to hire you, or let them know that you're pregnant. There are also things that happen, like that maybe even you have a longer work permit. There are crazy things that I've heard temporary foreign workers tell me that are quite unique. So there was a case that I heard about an employer that would have 1 job for a temporary foreign worker. And they would bring in, instead of bringing in 1 person for 1 job, they will bring in 5 people for 1 job. They will take $20,000 from each of the 5 people. That's $100,000. Where only 1 job is available. What happens to those other 4 people? They don't have a job, and they're in Canada. They have $20,000 that they're owing, right, each, right? They can go back to their country and try to pay $20,000 that they're owing, and now they don't know how to pay it. Or they can stay in Canada and become undocumented. So sometimes we wonder why people become undocumented in Canada and have no status in Canada, because we have people that are exploiting them that need to be arrested. I should have actually said that loud. because we have people that are exploiting them and need to be arrested. And if we arrest a couple of people, maybe we'll be able to actually get more people that are, that are legal in Canada. So to improve immigrant women's health, sorry, I'm talking too much, I didn't time this. Basically, two things, community belonging and address issues of income. So for example, address systemic barriers to employment for immigrant women, including barriers in credential assessment and recognition and language training programs, creating spaces of belonging. And I like that we have this opportunity because hopefully people will be able to connect and people will be able to start forming social networks. And those are some of the things that we need, calling each other up, bringing building the capacity of community and religious leaders. So there are some people that talked about community and religious leaders. I should say I've heard community and religious leaders talk a lot. I've also heard some things. So I did a study that I looked at women, parenting practice of women. And there was this woman that talked to me about her emotional and mental health status because, before she had kids, she used to go and celebrate everyone that was having kids, and she used to rejoice with everyone, and she was very happy and respected. And she had kids, and only because she didn't have a husband before she had kids, she was discriminated against in the church and basically ousted. So we need to also look at the ways that the exclusionary practices in institutions that are supposed to actually help in terms of, institutions that are supposed to actually be supporting us. Creating natural environments that promote social inclusion. And people talked about the examples of natural environment includes like parenting programs. And one thing they talked about is, when kids start talking together, parents start exchanging phone numbers and miracles do happen. The only sad situation is that, when I go to parenting programs here in Canada, I tend not to see immigrant women in the parenting program. So, we need to come out and get engaged. Capitalizing on the strengths of women. And a lot of times we tend to only look at weaknesses of people. I remember I interviewed a woman, a Somali young woman, and she had a child. She got married around the age of 17 years, and she had a child and she was still, less than 30. And we did the interview, she was happy. And then I made a comment about, she's gone through a lot and just acknowledged that she's such a strong woman. And she started crying. It's like, because she was so used to, when she tells a story, people are always trying to find a fault and bring her down. And just for me to just be able to say, you're so strong, was so empowering to her that she was like, just let everything out, all the hurt feelings. So we need to really be positive around each other. As I said again, community belonging, and I will end with this quote from one of my participants. She said, community is a structure that notices you as a human being in multiple aspects of your existence. Community is a group of people that notices you when you're well and not well. It's a group of people that notices you as a human being who has got family, a job, and hobbies. And that's it. Thank you so much.